Why do I talk so much about healthcare affordability as part of my three cares? Because the healthcare industry is literally crumbling around us. Here's some numbers that illustrate my point. 51% of Americans say they are worried about their ability to afford healthcare over the next 12 months. That's more than half of Americans. It's also the highest level in 5 years. Not surprisingly then, 1 in 4 U.S. employees are locked in their jobs for health insurance. Rather than taking the job they want or striking out on their own to start a business, they're staying in a job simply to maintain their health insurance. This is a huge wet blanket on our economy. But at least they have health insurance, which leads me to my next number, 20%. That's the spike some ERs are reporting in uninsured patients, according to the New York Times. And it's not surprising. Enrollment in Obamacare dropped by about 3 million this year when the federal government ended subsidies for the insurance premiums. And millions more are expected to lose health insurance over the next few years when the Medicaid cuts kick in that were used to fund tax cuts for billionaires. As a result, it's not surprising that we saw the crisis this year at the Capitol with HCMC on the verge of closure. But unfortunately, it looks like it's just the tip of the iceberg. And seniors on Medicare aren't spared either. 25 million is the number of seniors enrolled in Medicare Part D who could see higher premiums next year because the Trump administration ended a program that subsidized the cost of prescription drugs for these plans. Add it all up, and healthcare is a disaster right now. That's why I hear about it so much when I'm out knocking doors, and why I'm making healthcare affordability a key part of my platform for re-election. The federal government certainly isn't helping, and so it's time for Minnesota to make healthcare more affordable.